Around 1 million Filipinos have tuberculosis today. Similar to COVID-19, it's an infectious disease that predominantly affects the lungs, and it spreads when an infected person coughs or sneezes and another person inhales these germs. The good news is the disease is curable and preventable under the right conditions. On the program today, we'll talk about why it's so rampant here in the country, ways to prevent it, and the treatments that are available. I'm Dr. Freddy Gomez, and welcome to MedTalk Health Talk on CNN Philippines. While the COVID-19 pandemic continues to make headlines, there are other infectious diseases that we need to be aware of, and tuberculosis is one of them. The World Health Organization says it's the infectious disease that has caused the most deaths after the coronavirus. Our guests are here today to tell us how we can protect ourselves from TB. With us is Dr. Marion Arrollado Quek, who is an infectious disease specialist from the Asian Hospital and Medical Center. Also with us is Dr. Cyrus Gerald Pasaporte. He is an interventional pulmonologist from the Makati Medical Center. Now, earlier on the show, we mentioned that about 1 million Filipinos are battling tuberculosis or TB today. And that's the highest incidence rate of the condition in all of Asia. We rank fourth among the 30 high TB burden countries based on the USAID and Philippines in 2021 TB roadmap. Now, I'll start the discussion with Dr. Marion. What exactly is the reason why TB is so endemic dito sa Pilipinas?
There are a lot of social determinants regarding TB infection, no? And this is actually pretty common among low to middle income countries. And unfortunately, we have not yet surpassed this point where we are able to control it very well. Some social determinants like poverty, crowding, health-seeking behaviors can affect yung capability of these patients to be able to be treated so they can prevent infecting someone else. So these are things that are factors regarding how or why we have high cases of TB in the country.
Now, a big reason TB is so prevalent here is because many don't address the condition until they see late symptoms or there is no prevention. Now, we always say that prevention is still the best cure. Now, we'll talk more about ways to prevent it later on in the show, but for now, when you're first infected with TB, majority actually may not exhibit outward symptoms. Dr. Cyrus, when it comes to latent versus active TB, can you explain to us the difference of this?
When you say that latent TB, these are the person with a bacterial infection or TB bacteria, but they don't present any signs of symptoms. So they have not active type of TB, and usually they cannot spread infection. Compared to the active TB disease, these are a presumptive TB that usually they are considered as a bacteriologically confirmed, or we can say a clinically diagnosed by the attending physicians. So they are the ones that present the signs of symptoms. These are what we call the cardinal signs and symptoms who are presenting for more than 2 weeks. So these are the cough, we have the unexplained weight loss, unexplained fever, and also the night sweat. So this could be a pulmonary tuberculosis or it could be an extrapulmonary TB. So when you say an extrapulmonary TB, these are the tuberculosis that involving other organ aside from your lungs.
What are some of the factors that may shift that latent TB into it becoming active?
Usually these are in the patients who are what we call the TB high-risk groups. No? So these are the people living with HIV, those who have close contact to patients with TB, or elderly patient, or pwede din sa mga pasyente natin may mga uncontrolled diabetes. So they are the immunocompromised type. So they can, from the latent TB, they can be activated. So they will become an active TB disease.
Now, Dr. Cyrus, marami sa ating mga viewers, I'm sure nakikita nila sa movies or sa TV na kapag TB, one of the symptoms na nakikita is umuubo or may lumalabas na dugo kapag umubo sila. Is this common? Is this the symptom to watch out for kapag wala pang ubo, wala pang TB?
Actually, sometimes when you say they have the hemoptysis o yung pag-uubo ng dugo, usually it's already medyo malalang klase na po ng TB, no? So there are some kasi that they are asymptomatic. Usually some of them, Like for example, may mga pasyente po tayo na pumupunta, they have an incidental findings lang doon sa chest x-ray. So it's very important that we have to screen those patients kasi baka mayroon silang mga comorbidities na hindi natin nalalaman from the start. Okay, so the hypoptysis na yan o yung pag-uubo ng dugo is one of the complication of patients who have TB.
Now, Dr. Marion, let's talk about testing for TB. Ano ang test that is usually given here sa Philippines when it comes to detecting TB?
So, ang isa sa mga common test that we do is a chest x-ray. So, in fact, there are some patients who don't even have symptoms and they are just incidental findings on x-ray. And then there are tests naman na tinatawag natin for bacteriologic confirmation of tuberculosis. So, if we're talking about pulmonary TB, we request for a phlegm, sputum sample, and we do TB test called TB gene expert. This is type of a molecular test para po siyang PCR. No? So you're familiar with COVID PCR, especially now with the COVID pandemic. So the TB gene expert is actually a type of PCR test also for tuberculosis. And this can provide you with rapid turnaround times, which can facilitate faster diagnosis. And then there are other tests like smears, yung isi-stain po yung sample natin and check if there are some signs of TB infection, and also what we call a TB culture where you can grow the bacteria in the laboratory. And if there is bacterial growth there, then that confirms also your tuberculosis.
Poverty is a vital risk factor for tuberculosis. A change in behavior is needed. The World Health Organization, along with the Department of Health, are leading efforts to equip Filipinos against TB today. What are these initiatives of the government to end TB? More on this when we return. You're watching CNN Philippines. I'm Dr. Freddy Gomez, and welcome back to MedTalk Health Talk, where caring is our calling. The COVID-19 pandemic has severely impacted the fight against tuberculosis around the world. Here in the Philippines, testing and treatment has seen a decline. Part of the challenge is that the disease requires long and complex treatment. Now let's talk about how tuberculosis is treated. Dr. Cyrus, when it comes to TB, marami sa ating mga viewers, pag binigyan ng antibiotic, 7 to 10 days, okay na sila. Is this the same case with TB?
No, if we have tuberculosis, if we are diagnosed with TB, iba po yung gamutan sa TB. Usually the duration is 6 months or more, depende po doon sa organ involvement as well as the susceptibility of the drugs. Kasi meron tayong mga pasyente that they have the multi-drug or the multi-drug resistant type of TB, so iba po yung gamutan doon. Pero kung mga simpleng or mga pasyente lang na may karoon ng mga TB, like a pulmonary TB, that they are susceptible to the treatment, usually we give a treatment for 6 months. That's what we call the regimen 1. This includes the isoniazid, rifampicin, ethambutol, and pyrazinamide. But it's very important that you have to consult with your doctor kasi napaka-importante po na kailangan ay nababantayan po yung paggamot ng mga pasyente may TB.
One of the challenges the pandemic has posed to those with tuberculosis is that many have failed to follow up and complete their full treatment. And if treatment is not received or incomplete, this disease can be fatal. Now, Dr. Marian, tell us more about how COVID-19 has affected the fight against TB.
So definitely, COVID-19 has affected the treatment of TB in different ways. No? So one is the health-seeking behavior. A lot of patients, even for non-communicable diseases, are unable to follow up with their physicians. No? So yung mga annual check nila that maybe they're doing their yearly x-rays, they're not able to do that anymore. And then there are some naman who are getting their treatment from healthcare facilities, yung tinatawag nating TB cuts. There are some who are unable to go back to the center to get their free medications. And then for patients, syempre may mga nawalan ng trabaho. So yung iba, they are relying on the medicines coming from the center. So if hindi sila nakakapunta doon to get their medicines, then that can really affect how they are treated. So a lot of them may have defaulted, meaning tumigil na sa gamot and hindi na bumalik, no, for the treatment. So of course, this will lead to another problem, which is drug-resistant tuberculosis, because incomplete treatment of TB is a major risk factor for drug-resistant TB infection.
So, Dr. Marian, you mentioned on multi-drug resistant, binanggit na rin ni Dr. Cyrus ito, how this is a very concerning effect. You mentioned how ang hindi pagkumpleto ng inom ng gamot is one of the causes for this. What happens kapag isang tao ay hindi nag-complete at nagkaroon na siya ng multi-drug resistant sa gamot ng TB? What are their options now?
So someone who has drug-resistant tuberculosis, we have a different treatment regimen for this. So it's not the medicine that you can buy from the pharmacy. This is something that has to be treated under our government program called Programmatic Management of Drug-Resistant TB, or PMDT. So they have different medicines. The treatments are given for a longer period. And yun nga po, because this is something na facility-based na rin yung magiging pagkuha natin ng gamot, yung compliance and toxicities to drugs will be something that has to be monitored also, kasi mas matagal silang magagamot, and the medicines that they are receiving, each of these, depende dun sa cocktail na ibibigay, has its own drug toxicity as well. So yun yung magiging ano. But nevertheless, there are options. No? It doesn't mean naman that your drug-resistant TB, hindi ibig sabihin na hindi yun nagagamot. It's a lot more difficult, but of course, there's still medicines that we can give.
Now, Dr. Cyrus, pag-usapan naman natin yung mga komplikasyon kapag ang isang tao ay may TB at hindi ito nagamot ng effectively. Ano? Dr. Cyrus, first and foremost, meron bang pagkakaiba sa paggagaling ng isang batang may TB kumpara sa isang adult o isang matanda na may TB?
The most common is the hemoptysis, o yung pag-uubo ng dugo. Another one is the collapse of the lung, o yung tinatawag natin na pneumothorax. Yung iba nagkakaroon ng destruction ng lung parenchyma, o yung tinatawag natin na bronchoectasis. So yung iba, nagkakaroon sila ng mga extensive pulmonary destruction, may mga respiratory failure, yung iba nagkakaroon ng septic shock, yung iba din, minsan nagkakaroon sila ng malignancy because of the TB. And from the difference between the child and the adult, usually almost the same lang naman yung mga complication po ng mga pasyenteng ito.
Now, while tuberculosis typically affects your lungs, it can affect other parts of your body as well. This is why spinal pain is one of the most common complications of the disease. Dr. Cyrus, could you touch on this a little bit? Paano umaabot ang TB sa spine ng isang tao?
Okay, as we mentioned before, we have the extrapulmonary TB, di ba? So the extrapulmonary TB, these are the tuberculosis involving the other part of your organ. So aside from the lungs. So most common kasi na affected is your lymph node at 36%. But 10% will also involve the joints and the bones. And 40% of the cases will affect your spinal. Okay, so that's what we call the spinal TB or the PATS disease, or what we call the tuberculous spondylitis. So this involves your spinal, the vertebra. So the lesion will affect that part, will reach to that part, and then nagkakaroon sila na minsan yung pag medyo severe na, nagko-collapse yung ating vertebra. That's why they can cause a spinal pain. Yung the root naman of having extrapulmonary TB is more on hematogenous na po. Ibig sabihin, through the blood na po, yung pagkalat. Hindi tulad ng sa lungs, is more on inhalation of the bacteria.
As with most diseases, the best cure for tuberculosis is prevention. When we return, we'll talk about ways to prevent TB and the vaccines available to fight it. Your health is our mission here on MedTalk Health Talk. We'll be right back. I'm Dr. Freddy Gomez, and this is MedTalk Health Talk, your partner in healthcare. Tuberculosis is an airborne disease that usually attacks the lungs. And if left untreated, it can start to affect other parts of the body. While the condition is entirely preventable, it's one of the leading causes of deaths among all infectious diseases today. And this is why we urgently need to work towards eradicating tuberculosis here in the Philippines. Now let's talk about ways to prevent the condition, especially in a place here like the Philippines. Now, Dr. Marion, what are some of the steps that we as individuals can take in the fight against eradicating TB?
Now, as an individual, very important yung ating knowledge regarding respiratory hygiene and etiquette. And if there's anything that we have learned from the COVID pandemic, medyo mas aware na yung tao regarding infection control, no? So it's very important yung pagmamask actually for someone who is sick and coughing, we recommend that they are able to contain their cough, no, cover the cough, so that there is reduced risk na mag-aerosolize yung kanilang mga secretions. And then it's also important if we ourselves get tuberculosis, we have to inform our close contacts so that they can also be screened themselves because similar to COVID, TB is something that is infectious and people in the same household will be at higher risk of getting infected. Getting treatment is actually a public health intervention. If you are able to complete your treatment, or even during the first 2 weeks pa lang of getting the appropriate TB treatment, your infectiousness is actually reduced or even close to nil. No? So that will also be an effective infection control measure that you can do. Adequate ventilation and air circulation in the household is also one way where we can reduce the risk of infecting someone else with TB.
Okay. Now, Doc Marion, is early detection important? Is this something that we should really tell our viewers about?
Yes, no? So someone who is detected earlier, syempre we can also intervene faster. And a lot of people can be screened by just your regular X-ray. And in fact, a lot of companies in the Philippines, part of the employee annual checkup is an annual X-ray. Once you are scheduled, no, it's important for you to comply with your annual check. And because if we are able to detect the TB faster, we can treat you better. We can reduce your risk of transmitting tuberculosis to your coworkers or even your household members.
Dr. Cyrus, as mentioned ni Dr. Marion, na early detection is important. What can you say about those who na walang nararamdaman na simptomas? Is it practical for those watching to have themselves tested kahit wala silang nararamdaman?
Actually, the most important there is yung prevention. Diba? So we have to prevent, especially yung sabi nga ni Dr. Marion, you have to cover the cough etiquette is very important. And then in the companies nga, they have the annual PE, it included the chest X-ray. So ang pinaka-importante kasi dito once for the early detection is you have to avoid the progression. No? So if you have AD nakilala or part of the family that they have or they were diagnosed with TB, it is very important that you have also to do the screening test, especially the chest X-ray. So not everybody naman na kailangan magpa-chest X-ray if they don't have signs and symptoms. Pero the most important here is you have to also to check if there are part of your family member that they have or exposed to a TB, the tracing, the pinaka-importante dito. So we have to trace up who are those who are exposed and they have to do the baseline chest X-ray as the screening tool para malaman po natin kung meron talaga silang TB. Or if they're not, they have to observe themselves, especially for the 4 cardinal signs and symptoms of TB. That's usually more than 2 weeks. So, kailangan natin malaman if they still have the cough, if they have unexplained weight loss, unexplained fever, and then there's a night sweat. So, if they have that type of kinds of symptoms, either of the 4, they have to do the screening test.
Dr. Marion, balikan natin sandali ang BCG vaccine na binanggit. Usually, ang BCG vaccine binibigay ng bata, katulad ng sinabi nyo. Minsan nag-iiwan pa siya ng maliit na peklat on the left upper arm. Now, having this BCG vaccine, does this mean, since you said na mainly for TB meningitis, pwede pa rin magkaroon ng active pulmonary TB ang isang taong may BCG vaccine?
Yes, it's very possible talaga. Considering that BCG vaccine is part of our standard immunization for pediatrics, no, and still our TB burden is very high. So that goes to show that a previous BCG vaccination does not prevent you from getting TB infection at a later date.
While the COVID-19 pandemic is still very much here, tuberculosis is also a major cause for concern. Follow health and safety protocols to prevent from getting infected with any of these diseases. Thank you very much, infectious disease specialist Dr. Marion Aureliado Cuec and pulmonologist Dr. Cyrus Pasaporte for being with us today and sharing with us your expertise. I'm Dr. Freddy Gomez, and this has been MedTalk Health Talk. We'll see you again next time.